Carrying her infant daughter, 19-year-old Thisolisiwe Moyo waited for 2 hours to get birth control pills from a tent pitched near a village in Zimbabwe's capital, Harare. The outreach clinic is made possible by funding from the US government. It is important to be on contraceptives so as to avoid unplanned pregnancies, which can force one to have an abortion. It is important to space births and use family planning methods. But the services might soon stop if US President-elect Donald Trump acts on his threat to cut off funding for services that women around the world rely on to avoid pregnancy, as well as for health care unrelated to abortion.
My fear is that when the global gag rule is reinstated, it's going to be expanded. Project 25, talking about expansion of the global gag rule, talking about expanding it to governments, to organizations, to everyone who is receiving USAID funding. And that will have actually devastating effects in terms of access to sexual reproductive health services for women, in terms of choice for women.
Anglin Mokanya is getting a birth control implant to protect her from pregnancy for the next 5 years. She's already struggling to support her 3 children with the $100 she earns as a hairstylist. It's unfortunate that we are so far away from America, yet we're being caught in the crossfire of its politics. All we want is the freedom to space our births and be able to access free family planning services. Many NGOs in African countries rolled back services including clinics, contraception and support for sex workers during Trump's first term in office.